Carmen, and I'm going to be doing a head-to-toe assessment today on Rebecca Heron. Now I'm just going to be showing you the examination room that we will be in. Okay. Okay. Hello, my name is Carmen. I'm going to be your nurse today. I'm going to go ahead and wash my hands and pull the curtain for privacy. Okay, if you could please state your name and date of birth for me.
Rebecca Heron, 10/4/95.
Okay, I'm going to be doing the head-to-toe assessment on you today. Your age seems appropriate to your appearance. Now I am going to go ahead and ask you a few questions. Do you know where you are today?
Yes, the examination room for my head-to-toe assessment.
Okay, do you know what day it is?
Thursday,
Okay, do you know the specific date today?
March 31st.
Okay, patient seems oriented ×3. I'm going to go ahead and take a look at your overall hygiene. Hygiene looks appropriate and adequate. I'm going to take a look at your grooming as well, which is appropriate and adequate. Do you have any pain today? Any allergies that I should be aware of?
No.
Okay. Patient's mood seems attentive and appropriate. Patient's speech is not slurred and it is clear and appropriate to the conversation. Now I'm going to go ahead and assess your skin. If you could put out your arms for me. Okay. Your skin color is appropriate to your race. I'm going to be feeling for your temperature on both arms. Your temperature seems to be equal and warm on both arms. I don't see any signs of lesions or any scars. Now I'm going to go ahead and move on to your eyes. Your eyes seem symmetrical. Your pupils are equal. Now I'm just going to have you follow my pen light so that I can check for the dilation and constriction of your eyes to the light. Pupil dilated and constricted to the light. Pupil dilated and constricted to the light. Now I'm going to go ahead and have you follow my pen in the different directions. This is going to be testing for the accommodation. Okay, your accommodation was successful. I'm going to just be checking for your conjunctiva. Conjunctiva is pink and moist, and conjunctiva is pink and moist. Now I am going to go ahead and take a look at your mouth. If you could just open up for me briefly. Okay, your gums are not bleeding. They are pink and moist. Your mucosa is pink and moist. If you could stick out your tongue for me. Tongue comes out midline. It is pink and moist. Let me take a look at your tonsils, and I'm going to grade them a 1 to 2, and your uvula retracts midline. Your teeth are very healthy and white, which is very good. Now I'm going to just go ahead and kind of inspect your face, and I'm going to have you follow a few commands for me. Can you smile? Okay, there is no droop in your smile. Can you puff out your cheeks? Okay, cranial nerve 5 and 7 are intact, and your face is symmetrical. So now I'm going to go ahead and feel your neck for your carotid artery pulse. Your carotid artery pulse is strong in a 2+. And your carotid artery pulse is strong in a 2+ on this side as well. So now I'm going to just go ahead and listen in the same spot for breweries. There is no sign of breweries. And no sign of breweries here either. Now I'm just going to have you turn your head so I can check for JVD. There is no sign of JVD there. And no sign of JVD there either. So now I'm just going to go ahead and inspect your upper extremities. You could put out your arms for me. Okay, your color is appropriate to your race. I'm going to feel the temperature on both arms. The temperature is warm and equal on both arms. There are no scars or lesions on your arms. Now I'm going to feel your brachial pulse on both arms. Brachial pulse is strong in a 2+. Brachial pulse is strong in a 2+. Radial pulse is strong in a 2+. Radial pulse is strong in a 2+ here as well. Now just take a look at your nails. Your nail beds are pink. I'm going to check for your capillary refill, which is very good. It's less than 3 seconds, which is good. There is no sign of clubbing on your nails. Now I'm just going to have you grasp onto here. Okay, your grasp is strong and equal, which is very good. Now, excuse me, I'm going to go ahead and listen to your heart sounds. And before I do that, I'm just going to go ahead and name the valves that I would be listening to. I will be listening to your aortic valve, which is going to be in the second intercostal space right of the sternal border, and then we have your pulmonic valve, which is in the second intercostal space left of the sternal border, and then we have the Erb's point, which is in the third intercostal space left of the sternal border, and then we have your tricuspid valve. I am so sorry, your tricuspid valve in the fourth intercostal space left of the sternal border, and then we have your mitral valve, which is in the fifth intercostal space left of the midclavicular line. So now I'm going to go ahead and listen to your heart sounds and those valves going down with the diaphragm. Okay, I didn't hear any abnormal heart sounds. Everything sounds good. I'm just going to go ahead and listen to your apical pulse and the mitral valve for about 60 seconds just to make sure everything is good. And I'm actually going to be listening with my bell to get a better sound. Okay, 60 seconds have passed and there seems to be a good strong pulse. Now while I'm there, I'm just also going to listen to all the valves again going up with my bell. Okay, there are no abnormal heart sounds at all. Everything sounds very, very good. So now I'm just going to go ahead and listen to your lung sounds. I'm going to be listening to 8 lung sounds in the front and 10 in the back. So you're just going to have to take a few deep breaths for me. I'll be listening with my diaphragm. Okay, on the side. Okay, and in the back. Deep breaths for me. Okay, your lungs sound clear. There is no wheezing or crackling in the front or the back, which is very good. Now while I'm back here, I'm also going to have you lean forward a little bit so I can check to see if your spine is straight, which it is, and it is midline. Now I'm also going to percuss near your kidneys at your costovertebral angle to see if there's any tenderness at all. So you let me know if you feel any tenderness. Any tenderness there?
No.
Any tenderness there? No. Okay. I'm also going to do your anterior posterior diameter, which seems to be a 2-to-1 ratio, which is very good. Now when you turn back around, I'm going to have you laid this way so that I can take a look at your abdomen. Okay, I'm going to lift this up if that's okay. All right. Your skin color on your abdomen is appropriate to your race. There is a warm temperature, which is good. Okay. There are no scars or lesions on your stomach. And your stomach is symmetrical. I don't see any abnormal lumps or anything like that. So now I'm just going to go ahead and auscultate for the vowel sounds in all 4 of the quadrants here. Make sure that the vowel sounds are present. I'll be listening with my diaphragm. Okay, so all vowel sounds are present, which is very good. Now, I'm going to just name the organs that you have in each quadrant. So we have your left upper quadrant, where we have your stomach and spleen located. And then we have your left lower quadrant where we have your left ovary located and your sigmoid colon. And then we have your right lower quadrant where we have your right ovary and your appendix, and your right upper quadrant where we have your liver and your pancreas located. So now I am also going to palpate these 4 regions, and you let me know if you have any pain, okay? Any pain?
No.
Any pain?
No.
Okay. I am also going to percuss each region to see whether it's tympanic or dull. Okay, so the only area that seemed dull is where your liver is located, which is totally normal. I'm going to have you come back around for me, and we are going to take a look at your lower extremities. Okay, you could put your feet up here. Okay. The skin looks appropriate for your race. I'm going to feel the temperature on both legs. The temperature is warm and equal. There are no scars or lesions. Now I'm going to also feel for 3 pulses. I'm going to feel for the popliteal pulse right back here. Pulse is strong in a 2+. Pulse is strong in a 2+ back here as well. Then I'm going to feel your dorsal pedis pulse, just right here. Strong in a 2+. Dorsal pedis is strong in a 2+ here as well. Then I'm going to feel your tibial pulse right back here. Seems to be strong in a 2+. And right back here, strong in a 2+. Okay, so now I'm going to do what's called a Babinski test, where I'm just going to lightly touch you with my pen, and we'll see how your feet react. Okay, that's very good. They reacted appropriately. I'm just going to have you stand up for me if you could. We're going to do the Romberg test that checks for your balance. So if you could close your eyes, arms to your side, just stand there for a minute for me. All right, patient has stood for 1 minute. Patient's balance was adequate. There was no dizziness that I could observe. Now I'm just going to have you take a few steps for me for the get up and go test. This checks for your gait. Your gait seems very good. No problem. Now this was the head to toe assessment. You did very well, and we will have the doctor in shortly. Thank you so much. You can have a seat.